in the body. So that is a huge, huge change in how our healthcare approaches. And as massage therapy being at the bottom of the chain, we don't really have, exuberant amount of codes to build to these medical companies where we're making extravagant amounts of money. So at the end of the day, it's more along the lines cutting costs, making sure that that person is following suit for what they feel is good for them, and then taking any future issues, and sort of taking them into consideration. And in regards to insurance, if we can plug in a piece of software into our cars that's going to lower our insurance, why wouldn't we do the same thing to people if it's going to lower their insurance for the long term outcomes? So that's pretty much where I'm at with that.
Yeah, which, is a fantastic example of effective cost savings, right? You talk about cost savings in medicine, and that translates to the average person of decreased quality of care. In this case, it's improved quality of care, which in turn decreases the cost to the healthcare system, to the patient. I'm sure the patient satisfaction is fantastic, and provides a very viable, long-standing, solution to some of these issues. And I think that's where we as providers and we as advocates for the healthcare systems are really trying to find that, if like, most efficient, cost effective, best quality of care for our patients. And I think this is a fantastic example, and I am a proponent of massage therapy, let me tell you, for multiple reasons, least of which, when I go on vacation, I really need one. um okay, so Dr. Ganju, so okay, AI scares the dickens out of me in many, many regards, and then I'm super excited about it in others. Like, I'm part of this hospital steering committee at Epic in Verona, Wisconsin, and we're currently working on different AI models to help as clinical decision support and decision support tools, and developing that within their electronic health record. And I'm one of their advisors, and so I'd like to know, how can specialists integrate AI to really enhance care delivery, and what does that look like for your patient population, which is the menopausal woman? Because I'm getting there.
Yeah.
We're all getting there.
This really plays into sort of the biggest question of AI, which is how do you ultimately trust it?
Mhm.
And to me, that's heavily based on how did you train it? And so we've taken actually a slightly different approach than sort of the mainstream approach to AI, which is gather as much data as you can from as many places as you can, create the model. There is an alternative, which is what I think makes more sense for healthcare, especially in our field, women's health. If there's any other area where trust becomes critical and essential, it's in our field.
Mhm.
Once you break it, it's gone.
Yeah.
Um, so in our field, what we have figured out in our company as well, if I trust my doctor, train the AI on the doctor herself.
Mhm.
And this is kind of the approach we're taking, which allows trust to occur. The physician can now trust this model because it's speaking and displaying behaviors that are your own. The patient trusts the model because the patient trusts the doctor.
Mhm.
So this is an approach that to me is much more reliable and much more favorable, and this is what we've been studying in our research of the models we've developed. Um, Now compare that to a big, large model from a Google or Microsoft or OpenAI, and you're not exactly sure what did it get trained on, and oftentimes they're being trained on things like um, guidelines, national guidelines. But this is not how I deliver care. This is not how doctors deliver care. We use the guidelines, but ultimately it comes out of our mouth, our opinions, which are valid to a degree and are informed by evidence, are informed by research, and continuously evolve and adapted to each individual patient. And so this is the approach in healthcare that, to me, I am convinced is really the only way, because why would I ever trust another medical product from another big box tech company.
Excellent, excellent. Yeah. And I mean, I think that really resonates for the folks in this room. If you're a clinician, if you're a physician, if you're a mid-level provider, in that you can't take that art of medicine, that intuition. I call it my physician spidey sense. Those little hairs on the back of your neck that stand up that tell you that your patient is about to deteriorate and what to do about it. That AI can't necessarily solve, but if we can find a solution that takes the mind of the physician and really helps it develop some of that spidey sense, some of that intuition, some of that critical decision making that comes only with experience and seeing a variety of things. Guidelines are guidelines, right? They're there to help guide us, but they should not be prescriptive as to how we practice and what we do. And, the tools that you're developing are much, and again, scarily sometimes, much more human-like in their characteristics as opposed to, Google, which, you know, no problem with Google. I use it all the time. I used it 15 times before I got into this room, to look up a variety of things, least of which where I'm going to go to dinner tonight. But it's, one of those things that black and white picture is something that's very difficult for AI to solve. And I think your approach to it is just absolutely fantastic. I can't wait to see, where you go with it for the future and then utilize it myself. I want to be one of your early adopters. Let's put
I'll
it that
send
way.
you a link.
Yes. So, Lucas,
Yes.
you have a very interesting niche. We talk about, like, and I think I said this on our Zoom call the other day, especially in the surgical services realm, that the surgeon gets what the surgeon wants.
Yes.
In your case, the surgeon doesn't necessarily gets what he needs, not necessarily what he wants all the time. And I know that that's kind of a difficult fine line. And for those of you who are surgeons, I'm not picking on you. It's just what he does. But what I'd like to know is, how do you best help guide those surgical services teams, like to maintain compliance with policy and regulatory, and like what barriers have you had to overcome besides people yelling at you that they're not getting exactly what they want?
um, well, as we know, hospitals are pushing to streamline everything. The problem with Americans in particular is we want individualized healthcare. So how do you create a balance between us, the people, wanting individualized healthcare and hospitals wanting streamlined healthcare? So you have to come to the balance of how can everybody win in a situation, but do it safely. So a lot of times I'm having the conversations with the surgeons that they may want this or they may want that, but is it good for the patient? Is it good for the hospital? If it's a trial, has that patient consented to have this item tried on them? And I understand that the hospitals have to make those decisions and have to make those, but the patient, a lot of times, someone has to advocate for the patient while they're asleep. So there's a lot that goes on the backside that the patient does not know about, the meetings that has to bring these products in. If it's a specialized surgery, how do we streamline the actual baseline of that, but give that patient the individualized results? I, as a patient, certainly don't want to be treated like the next person because, as my opinion, I would believe that my body could be different. So, how is it that hospitals can bridge the gap between the two? And so, my job is to be cost effective in the hospitals, but make everybody happy. Explain to the surgeons why this is the process, why the patient needs this, and also explain to the patient, these are your choices. You have choice A, which will give you this result, choice B will give you this result, and how can we come to the happy medium? And so, a lot of times those conversations are really difficult to have because someone is going to be mad, but at the end of the day, how can we come to the best conclusion for both the client, the patient, and keep the surgeon satisfied so they can keep booking cases at the hospital? And that's basically what it all boils down to.
When you're the regulatory, boogeyman in the room and you have to tell people, no, no, you can't. No, this is outside of scope of practice. No, other people can't make decisions for the provider. It's the provider's decision. They need to write the order. They need to do, this and that. No, no, you cannot have this particular device, either because it's not cost effective or because it's is very cost effective, but it's just the wrong device for the patient. Going back to things like hip replacements, I mean, there's dozens of them and some of them are, good and some of them are pretty darn scary. So completely understand that you can't be everybody's friend all the time and expect people to really go towards what they need to do regardless of how difficult it is. And sometimes in healthcare, and again, as advocates for these, healthcare systems and for our patients, we have to be the ones to say, no, I'm sorry, no, you can't. I know you don't like it. You can go across the street, but they're probably going to get penalized and they're going to bring you down with them. And so you need to be that person. You need to be kind of that tough guy. So I love it. It's fantastic. And it's really creating more efficient medicine and what's better for the patient. Because let's face it, I've been a patient, you've been a patient, you've been a patient, everybody's been a patient in this room at some point in time. And, we need people like Lucas to fight for us to make sure that everybody's up to date with what they need to do from a policy regulatory standpoint, device management standpoint, surgical standpoint, so that we have the best outcomes. So we're all working on it. Awesome, awesome. And so Dr. Khan, so let's cut to the chase. So we've already talked about AI a little bit, but I'd really like to see your approach. Like, what is AI doing to healthcare? Is it running it through like a hypercycle? Is it just hype? Is it real? Is it what are your thoughts on AI and where we're taking this in medicine, especially as a hospitalist? I really like to know this because we have to, have our fingers in every single little pot. So
Right, definitely. So we definitely are in hype. I'm not really sure we're in a hype cycle because hype cycle crashes. I think the hype is real. I think this hype is going to be emanating and moving into all spheres, so especially healthcare. And if you look at any projections, there was a projection by the World Economic Forum that by 2030, AI in healthcare will be a market of around $188 billion. So that is huge, and you cannot deny that in a way. So having said that, you have to have real use cases that actually bring value, and that's where people are getting at, and that's where healthcare will be going. And when you look at the future of medicine, AI is going to be part and parcel of it. Let's take a few examples. Um, uh, diagnostics, and that's going to be changing drastically. When DeepMind picked up and tested humans versus AI, it said that DeepMind was actually able to diagnose breast cancer better than physicians, and that was mind blowing a few years ago. Move forward a couple of years, now you know that AI is reading radiographs. They can read thousands in a second, and the radiologist takes couple of minutes, and that helps me out and her out in the hospital when you're looking for that MRI report, and you're not too good at reading MRIs, and you need that report for that patient, and you need that quick. So nowadays, in the future, near future, you're going to have reports generated by AI, and the radiologist is going to just sign off on it, read through it quickly that hey, this is valid. Similarly, we had developed a colonoscopy lesion detection, and now the gastroenterologist usually has to go in, take pictures, put it together, put some notes onto it. So we had a program that, okay, you can detect a lesion. It can automatically tell you what it is most of the times. And the gastroenterologist basically signs off or makes some minor adjustments. These are use cases that AI is going to be used for. Then you have drug discovery. Now, you in the past you didn't know what the side effects of that drug would be or the bioavailability would be. Nowadays, you can use AI to do that within days or even sooner. That would have taken months to figure things out. Then, if you look at other aspects of AI, which will help our practice per se, is transcription. And I was on a podcast with a neurologist, and he had a program, Dr. Junaid. Dr. Junaid, I'm forgetting the full name. So he demonstrated during the podcast that I acted as the patient, and he was the physician asking questions. And by the end of the conversation, the note and the plan that was explained to the patient, including all the history taking, all the review systems, and everything else, and the physical exam findings were automatically turned into a doctor's note. And we know documentation is a second job for physicians, and you go home sometimes and you have to fill those up later in the day. So So yeah, AI is going to be part and parcel of our practice as we go, and it may mean, and I would like to say it may mean that we may need fewer radiologists or maybe even fewer hospitalists. And one hospitalist may be able to see many more patients instead of the 20 patients that we are currently set to, target. And in the future, somebody like me may be able to see many more patients. So it will have a ripple effect on this whole economy. So yeah, there are many. Yeah, AI is here to stay, and I don't think it's just hype.
Yeah, I mean, certainly creating, increased efficiency in how we practice. Right now, you could see as a hospitalist at least, we'll see, 15 to 22 patients a day, depending on census. And, you might spend 5 or 10 minutes on one patient where you spend an hour and a half on another. So it's really variable. Things are going on, people are crashing and some days you you just don't have time. And one of the burdens on the everyday, clinician, physician, so nurses, doctors, APPs, is documentation. I mean, it just sops up all of your time. And that's to, certainly satisfy the payer's needs. You've got to satisfy all of the, the guidelines. You've got to satisfy CMS, Joint Commission, all of those things, and make sure that you're still giving the best possible care to your patient. Like it's almost an impossible task. And so much to your point, utilizing, AI resources, not chat GPT people, using AI resources, intelligent AI resources that help the physician, that help the average clinician, that speed up the process, that take the busy work out of all of the stuff that we have to, just document forever, you know, can definitely create, significant efficiencies in how we practice medicine. And hopefully, the result of that is spending more time at the bedside with the patient. I mean, that's what we all went to medical school, we went to nursing school, we went to, you know, tech school or, whatever have you. We went into our fields because we wanted to touch people, you know, whether it be physically, whether it be emotionally, whether it be medically, whether it be surgically, all of that stuff. And the current healthcare, especially in the United States, the way that it is, has gotten so redundant and so, prescriptive of how we're supposed to be practicing and what we're supposed to be documenting to satisfy, again, going back to the payer's needs, um, which I'd love to have Brian come up and speak about as well. And, you know, that it sops up your time and you end up spending so much less time with your patient, or you spend as much time as you can with your patient and in the back of your head thinking, I I don't have time to do this. I don't have time to eat. I don't have time to sleep. I don't have time to pee. I don't have time to, hydrate. Goodness, I can't imagine how many people in kidney failure half the time because we don't have time to even just do things like drink a glass of water in the middle of the day, because it, the healthcare system has become so taxing and what we have to do in the electronic health record space, especially. So having tools like these that speed up the efficiency of providers will not only improve the efficiency, provide hopefully more time at the bedside, but also decrease burnout. I mean, we're dropping healthcare providers like, like lead bricks. And some of these efficiencies, although scary, and we have to learn to utilize them in a very thoughtful manner and in a very responsible manner, with uh, power, what is it? The power is corrupts and something corrupts
Our
absolutely.
corrupts absolutely.
Thank you. Um, Terrible with those things. I shouldn't even say those quotes, especially in front of a large audience. But we
Absolute
have to
power.
be very thoughtful about how we roll out these technologies and make sure that they're not replacing humans, but working with humans to improve the face of our healthcare. So bravo, guys. This is awesome. Um, so I'm going to do a little bit of a round table now, and I'd like to just have I think we have what 10 minutes left in the panel, and I was hoping to give opportunity for people to ask questions if they'd like. But I'd like to just do a quick flash roundtable of kind of your final thoughts. Like, what would you tell the folks in this room, the folks listening, hopefully on the YouTube video? You know, what do you see in the future of healthcare? Where are technologies going, and what you would have to impart to them?
Yeah, yeah. I mean, for me, it is kind of pessimistic as it can sound at times. I'm very positive. So I think conferences like this, bring people together and we can have open dialogue about some of the current issues, but also what are some of the things that can help move us forward, right? Educating patients to be self-advocates, and when we are all together, be passionate, take pride in what we do, and let's march on into the future.
So thank you.
I'm gonna say at this point, I think a lot of people have lost trust in doctors, and there needs to be some sort of safeguard implementation on how a client is approached when they're having a problem. And the only way that's going to sort of separate those two, the greed and also um, the individual's health, is to have some sort of buffer in between those two. And AI is going to be a great buffer in regards to having people be more aware of what's going on with themselves. And I just think that people are also just tired of, you know, being used as almost cash, cash ATMs, I should say.
Cha-ching, cha-ching.
Exactly. So I think the transition is going to come a lot sooner than people believe and that are ready for, and I'm hopeful for it.
Awesome. Thank you.
I think the top specialists of any physician field are always going to be the most in demand, and probably in demand in the coming world, not just nationally, but globally. How do I get as many patients and as many women who want the best doctor across the world, that doctor that they want? So to me, this is sort of what I'm looking at into the future is the creation of an ability to have access to nearly unlimited time with the top specialists, because that's the only way to actually scale care with the best care that's out there.
That's fantastic. Thank you. Lucas.
Um, I would say as consumers to all of the medical facilities and products, I say that us as consumers of medical products, we learn how to read our own charts. A lot of times a doctor or a surgeon will come in and say, "Hey, do you have any questions?" Or they will prescribe you something, and you just take them for their word because you really don't know how to read charts. And I've been that patient. I didn't know how to read the charts. I was prescribed something, and later down the line, I realized that I never needed it. So that was one of those times where I lost trust in a facility. But it should have been me that have learned about what am I reading, how to ask those secondary questions that I didn't even know to ask. So when we as consumers start doing that and start demanding that the doctors explain these things to us, go over my chart with me. I learn my chart. I learn how to help you treat me. Then the doctors will be held to a higher standard, and then we will regain the trust in them because now they know that the consumers will know what they need to know, and that will make the hospitals invest in the doctors more. Give them more doctors, give them more time, give them more training, give them more education, and then we'll start seeing healthcare really change.
Fantastic. Thank you, Dr. John.
So yeah, so I'm actually optimistic, and there is a Chinese saying that may you live in interesting times, and actually that was as a curse if I remember correctly, and you can correct me if I'm wrong. We are living through interesting times, and I think these times are going to be positive for the healthcare side of things, positive in better patient care, better patient management, better outcomes, and that's what we are talking about right now. And everybody has their own sort of niche where they want to improve outcomes and improve patient care. I think that's what we're looking for in the future, and I believe we hopefully get there sooner rather than later.
Yeah, absolutely. I think that again, going kind of back to the vision of what we want to achieve in healthcare, it's about improving the quality of care. I mean, we have amazing healthcare in this country, but our outcomes are unfortunately terrible, as compared to even other even third world countries. And I think it's folks like my fellow panelists, and hopefully I'll have some influence over that, consulting and advocating with these healthcare systems, and with the leadership in the leadership role that I've come into, where we do have an opportunity to really improve the face of healthcare, increase efficiencies, reduce costs, have better outcomes, and increase the quality of care that we deliver, especially to our patients who we need to keep first and foremost in our minds. So, with that, I would really like to thank all of my fellow panelists. You guys are rock stars. I am super happy to get to know you. I am very, very pleased that you're all doing exactly what you're doing in medicine right now, because I think that you are very, very much the emerging face of healthcare and healthcare specialties. And thank you guys very much. I'm going to open it up to questions if anybody has. And thank you all very much for being here with us. Now, I don't see any microphones, but I have a very lovely lady up here with her hand up. Did you guys hear all of that?
Yeah.
Yeah.
That's a tough one. I think one of the things that's hardest in rural communities, I think as you described, and it's also the kinds of patients that you have, um, especially if they're older, especially if they're not tech savvy, much less maybe don't even have internet easily accessible. Um, how do you sort of not allow them to sort of be left behind while the rest of the world is sort of steered in a single direction? I think um, I spend a lot of times in kind of rural and frontier areas of the US where I practice a lot of my medicine, um, and this is a genuine issue. I think there the problems are not necessarily what you necessarily need to solve through AI. I actually think there's a whole different approach to that, um, but there is a bridge, and that bridge I think is maybe through more technology, which I hate to even think about it that way, but ultimately, what those communities need is a lot more humanistic care than technological care. But I, I haven't yet quite solved that one. I don't know if other panelists have some thoughts on that.
I'd love to hear Dr. Khan as well.
Well, yeah, I definitely agree in a way that more technology is always not the best at every solution, but in remote areas, now we are getting to a stage where you may have internets, Starlink, perhaps other companies. Jeff Bezos is doing something similar. So that is going to come to be. And you had a very valid point that people may not know how to use technology, right? And I remember that when we were working on our remote monitoring for COVID-19 patients. So back in the day, they could be elderly; they didn't really know how to use an iPad or something similar, and you knew they will not be using that apparatus and machine. Now, and what we had done was we removed the patient from being able to actually handle it much. So the doctors, family members, nurses could interact with the patient inside the rooms remotely from wherever they are, without having their much input from the patient, and they would interact as such. And families prefer that with their elderly people who are confused and debilitated. um, Similar to the network, and is already transmitting. The patient does not need to actually press a button to put the recording in a mobile application. It can be all done remotely. So these things are coming in. Samsung has a ring. There's an Aura ring that is a very well-noted company that can track numerous aspects of the patient's vitals. So um, I think you can definitely find resources that can reach remote areas. And I think here maybe advancement in technology is actually going to help very soon in the near future. Yes.
And I certainly don't have an answer, an all-encompassing answer to that question. That's a very difficult, you know, uh, it's a very difficult problem to solve, right? Um, in the case of the wraparound centers, though, the first thing that comes to mind, at least in my mind, and in a lot of other rural areas, is sometimes leveraging lower level technologies. I mean, almost everybody has a cell phone, not necessarily a smartphone, but they might have a flip phone, a digital phone. So things like bulk, telemedicine, that you could leverage in those centers, certainly comes to mind. The patients can't do them in their own home because they don't have access to internet or cable or whatever it is. But utilizing those centers as a median and then cooperating with other centers and other organizations around the United States to provide some of those things like telemedicine services or even just phone consultations, to some of those patients. They might not still be getting the best face-to-face care, but they will be getting some care by hopefully a specialist. And even in larger healthcare systems, I mean, I work in Albuquerque, New Mexico, and half of our hospitals don't have providers. I mean, they have hospitalists, but we don't have ENT, we don't have neuro, we don't have, in some cases, goodness gracious, cardiology. I kind of feel like that should be a basic service for a hospital. And we're leveraging more and more things like phone consultations. We're leveraging email, even on secure HIPAA compliant platforms, and we're leveraging a lot of telemedicine services. So not an all-encompassing solution that also just as I can't remember which one of you had said, that might need a little bit more tech to actually pull off. But I think that finding a fairly simplified solution might be, again, not the full solution to your problem, but at least a help.
I have one comment going away from technology a little bit, and I don't know if this is possible, but one of the things that we sometimes can have a challenge with is getting the typical westernized patient to introduce them into Eastern medicine. We try to do that through a sense of community, and maybe that's something that could help by having an event like such as breath work. We try to regularly do that a couple times a month, or we'll invite some of our rehab patients into breath work. And at the breath work ceremonies, we talk about, what are chakras or what is energy, what is emotional trauma, going through the actual ceremony itself with sound bowls. And then they have the best sleep ever. They're taking less pain meds, or they feel a lot better the next day. And now they're introduced to the world of Eastern medicine, and it's not as scary. So I think maybe a sense of community, if you can create that, and you really don't need technology for that.
That's a great point.
I want to second Chad. Uh, the future of healthcare needs to combine um, the what humanity has learned over the past centuries, and not everything is, of course, perfect, but you weigh and consider what has reliable enough evidence, and you combine all of this for a more holistic management of the patient, and in conjunction with Eastern medicine, allopathic, whichever medicine you want, and combine it all together for a better outcomes.
Couldn't say it better. Thank you very much.